Well, hair loss can be a real problem for some people, and stress can have something to do with it.
Absolutely. Our 9 News health expert, Dr. Payal Kohli, joins us now to talk more about what causes it and some treatments. Good morning. Thanks for coming in.
Good morning, guys.
So how common is hair loss and why do so many people have it?
It's incredibly common. I mean, most of us know somebody or ourselves have gone through it, about 80 million Americans. And what's interesting about our hair is it follows a life cycle. So every day an average person sheds about 50 to 100 hairs. And that's a normal part of our healthy scalp and life cycle. If it starts to be more than that, and it can be for a variety of reasons, genetics, hormones, medications that we're taking, stress, any kind of physical or emotional stress can really speed up the way that our hair sort of turns itself over.
And I want to ask, because you put emphasis on the word stress, how does that factor into hair loss?
You know, it's such a huge part of it, and sometimes we don't even realize, but it's actually a disease process called telogen effluvium, where the hair follicles enter into what's called a resting phase. So they're not growing, they're not replicating, they just start falling out. And it can be any kind of physical or emotional stress. So after a viral infection, after a car accident or the loss of a loved one, any kind of financial stress, after childbirth, these are all states in which our body kind of goes into a stress response. Now, the great thing about telogen effluvium or stress-related hair loss is that it's reversible. When you get rid of that stress, you can reverse it, but it's really important to sort of get in early and get it evaluated to make sure it's not something else.
Are there different types of hair loss, and at what point do you see a doctor about it?
Yeah, there's many different types, and some are medical reasons for hair loss. So the most common that we see out there is kind of the male or female pattern baldness, receding hairline, getting a bald spot. That's called androgenetic alopecia. And that basically is largely driven by your genetics, but can also be affected by hormones like testosterone, estrogen, and so on. That can be treated with drugs like Propecia, which is finasteride, or minoxidil, which is Rogaine. So it's really important to get in to see somebody early if you're starting to note a receding hairline, because the earlier you get in for treatment, the better. And usually you would go see a dermatologist. If you see a bald spot or a patch, that is never normal. And that's called alopecia areata. In fact, Jada Pinkett Smith kind of shared her journey with that disease. That's where your immune system attacks the hair follicles. And you get these oval or round bald spots that occur. And you need to get in early to get those injected with steroids to really help sort of the improvement. And then there's also a condition called traction alopecia. We tie our hair in tight ponytails, or we put in extensions, which women do a lot of times. You're actually pulling at that hair follicle, causing tension on it and damaging it in that way.
Now, what about other effective treatments outside of what you just said?
Yeah, so these medications that I talked about, certainly steroid injections if it's alopecia areata, but even some natural remedies can help with hair growth. So doing a scalp massage has actually been scientifically proven because it stimulates the circulation and the blood flow to the scalp. It kind of sloughs off those dead cells. Washing your hair often enough, but not too often, to maintain scalp health. If you're having a lot of dandruff, that's a sign that your scalp's not as healthy. Essential oil massages, rosemary oil and lavender oil have both been shown in randomized controlled trials, so high level of scientific evidence to actually help hair to grow as well. And then nutritional deficiencies if you have them. You know, a lot of people talk about biotin. Unless you're deficient, I don't generally recommend it. But B12 and vitamin D are big ones that are involved in hair growth that many of us can be deficient in.
Just really quickly, I want to ask a follow-up to what you were talking about with the shower situation, because I think a lot of people don't understand what the right amount to wash your hair is.
Right.
Is there like a good rule of thumb to follow?
Yes, so I would say if you're starting to get any kind of residue on your scalp, that's a bad sign, especially if you're using a lot of hair products, which many of us use, that can create residue. Then it's time to wash. Usually people say about 2 to 3 times a week. And when you wash it, you want to be sure to use some sort of exfoliator, scalp exfoliator, to actually massage your scalp and rub that shampoo into the scalp itself rather than just on the ends. Yes, exactly. And you want to make sure to get lots of sleep, lots of hydration, sort of take care of your hair from the inside out, because hair is so important to our self-esteem, to our appearance, to how we feel about ourselves, and it's something that's highly controllable and highly treatable.
Great information, Dr. Kohli. I really appreciate it.